thanks very much for inviting me. And every time I come here, I'm impressed with how men are starting to get together and talk about their illnesses, you know. The masculine energy is kind of a closed energy, as you know, and it tends to not be so open about their problems. And we were sharing earlier, there's this issue of not wanting to talk about disease, not wanting to talk about and bear your problems. So seeing this kind of group evolve and get bigger and start sharing with the community and talking about the activities around prostate cancer awareness is really, really gratifying. So I thought I'd start out with a couple of questions. How many of you over the years have used supplements? Can you raise your hand? Okay. And how many of you have used or thought about using alternative medical care? Okay. And how many have availed yourself to acupuncture? Okay. So, you know, I think that there's this aspect that I want to address that I'd start with by my own story of how this evolved, how I got into this this topic that we're going to talk about, this alternative medicine deal, so to speak. Because, you know, over the last 2 decades, the medical consumer has increasingly looked at alternative therapies in terms of the management of their problem, either as what I would call an addendum to their health care and to their allopathic approach to medical care. In this case, we're talking about prostate cancer, right? And we're saying, well, are there things that can be used in addition to the therapy that you're undergoing, whether it's RT or whether it's surgery or hormonal therapy, whatever it is, you know? So there are those kinds of adjunctive, what I would call adjunctive therapies that can be helpful in the treatment of the primary disease. And so I wanted to try to give you some perspective about alternative therapies, alternative medicine as it is, and try to bring it into a kind of an understanding of the greater whole, so to speak. And that begins with my story, but then we'll talk about really what is alternative medicine from my vantage point, and then why is it meaningful to you, or why would it be of value to the medical consumer today to look at that? So back in 1972, it's a long time ago, I graduated from medical school and I finished then my urology training in 1979, and then started practicing here in Tacoma to do what I was taught how to do, which is to treat disease. And during that time, there was really not any concept of prevention. There wasn't really an idea that prevention of disease could really take place. It just wasn't in the vernacular. And so I moved along through that early part of my career. And then in the 90s, I became interested in this fellow. After finishing a book project, I was listening to a fellow talk about alternative therapy, or a different way of looking at disease. And he was an endocrinologist, and another fellow physician named Dave Simon, a neurologist, were really embarking on this talk about the idea of a different type of way of seeing healing. And Chopra and Simon became friends of mine, and I did a lot of work with them over the years. And then, you know, I was standing at the sink one morning and I said to my wife, I said, you know, if I'm using and talking about this in the community, I really should be maybe using it for my own needs, which were really essentially revolving around gut and digestive issues. So that set me on this journey of going to this Ayurvedic teaching institution. And after a period of about 4 years or so, all my problems, which I thought were initially food allergies, weren't really food allergies at all. I had painted myself into this nutritional corner, and I was thinking that in some way or another there was some kind of problem with me in my reaction to food. But it wasn't really the case. And so that led to my interest in just sharing it with my patients. And one of the more difficult problems in urology is called interstitial cystitis. In men, it's chronic prostatitis. But in reality, it's one and the same. It's just an inflammatory, non-bacterial, that's very important, non-bacterial inflammatory change of the bladder. And so I started talking to patients about that, and I was really taken by the fact that I was giving these people just simple nutritional information, and yet they would come back, oh yeah, all my symptoms have gone. So that led to me writing a book called Foods Heal, which was a book about contrasting the Ayurvedic approach or the energy science approach with the matter science or molecular approach. What Chopra and Simon were really introducing is a model. It's very important to get the idea that there is a model of healing presently that we all interact with, called the allopathic tradition. It's currently the tradition that we hold to be the way to deal with healing. And indeed, it has great relevance for us. There are those of us in the audience here who have been treated with robotic surgery. We've had sophisticated radiation therapy protocols, and they have eradicated our disease. And there are some who have maybe perhaps more advanced disease. And yet, those of us who have advanced disease have also had significant benefits from the allopathic tradition. And I'm one of those providers who feel very strongly that there is a significant benefit to the allopathic tradition. I'm not here advocating that we run out to see alternative care providers. But the issue is that there is room for that because we are both a molecular collection and an energy field collection. We are both energy and matter simultaneously. You see, that's really the key here. That E = mc squared has great relevance for us. What that equation says, that was articulated 100 years ago, 100 years ago, it said that energy and matter are interchangeable at a constant. That means that what you're looking at here, if you put your energy field glasses on, you see an energy field. If you put your matter field or molecular glasses on, you see it as an allopath sees it. So what was churning in my mind was, well, there's obviously two models here that are going on, two models of healing. There's a model that's a molecular model that tells me that PSA can be a marker for prostate cancer. But from an energy field perspective, I can look at that marker and say, it's a molecular expression, an energetic expression of inflammation. That's why PSA, as we all know, is not a marker for cancer, for prostate cancer. It's a marker of inflammation. And oh, by the way, it happens that there's a lot of inflammation in prostate cancer. So when your PSA goes up, you're measuring the inflammation, and 40% of you happen to have prostate cancer, as a biopsy shows. So the idea here is this, is that there are two models that are out there in my mind. There are two models of seeing the body, and there are two models or disciplines of healing the body. One from a matter or molecular standpoint, and one from an energy perspective. So what's alternative medicine? And personally, I don't like the term. I think that alternative medicine means that you're doing something different or alternative. But in reality, what the term really should be is something that allows the room for an energy science approach. Now, there are two big giants in the energy science world. And the traditional Oriental medicine discipline, from which we get acupuncture, is one of those giants, and Ayurveda happens to be the other. Why are they giants? Because they've been around and articulated for not a couple of centuries, not for 1,000 years. For 5,000 years, these disciplines have been around. Now, I don't know about you, but I tend to think that longevity has something to do with the benefit or the significance of a tradition. And so you see these terms, prana and ki and chi and ru and rua. These are all terms that these people, way back when, used to define and express about the energy field. And these cultures created these disciplines in China and in Japan and in India. And so these disciplines became very rich in terms of their expression of how they went about healing. And this is in contrast to, I want to be very clear here, that this is in contrast to what we presently talk about when you sometimes hear on the street, Mildred underwent energy work. And this is not what I'm talking about here. I'm talking about a defined discipline that sees the body anatomically, and that's very important, anatomically as an energy field. And there's just an entirely different lingo that goes on, different type of language that goes on when you're talking about the body as an energy field. Energy anatomy is what we call it, energy anatomy and physiology. So what does that have to do with you? Well, we heard earlier, we were talking about this issue about prevention, you know. Somebody has a nephew who has it, he's at risk. He's got actually a 30 to 40% chance of having prostate cancer. And then you add on the fact that the possibility that he's obese, it's another risk factor. So these issues are very, very important in terms we prevent disease. So, are you okay, sir? So, the energy model is a defined, very specific, and important model. The molecular model is an important model for healing. You know, if I'm involved in a car accident, I'm not going to take some herbs. I'm not going to do some nutritional work. You know, I'm going to go to the emergency room. I'm going to get some x-rays. I'm going to get some blood work. And I'm going to find out whether I have any problems from that accident, any internal injuries, and then see appropriate consultants for that. So there is this added aspect of matter science medicine that's very important. We've talked about that with respect to how you use the molecular approach for the management of this disease, prostate cancer. Well, one of the things I think we can say for sure is that the matter science approach doesn't do chronic disease very well. It doesn't do much for prevention at all. As a matter of fact, zippo, because prevention needs to understand that there's an origin of disease. And right now, the molecular model doesn't see or doesn't have a model that understands the origin of disease. But the energy science model does. It articulates it very clearly. And says actually that there are 4 stages of disease before the molecular expression actually occurs. Isn't that amazing? I mean, that these people thousands of years ago were able to understand the origin of disease from an energy perspective and put in place prevention measures. Pretty cool. And so for a friend who's talking about his nephew, I mean, that fellow should be counseled. What about somebody who has 3 primary relatives? I've seen this in my practice. 3 primary relatives with prostate cancer. Now, those relatives of that individual have a huge 60% chance of getting carcinoma of the prostate in their lifetime. Now, for me, that would be a real harbinger to look at in terms of, well, what should I be doing in order to avert the possibility of prostate cancer in my lifetime? Now, there's a problem here because most people don't get off square or point 0 without pain. We just don't do it. Now, why should I change my diet? Why should I do any lifestyle issues here? Why should I do anything in terms of prevention until I got a problem? So there's PAIN is a big issue. You have to realize that it's human nature to ignore reality until it strikes you. But right now, we do not, I repeat, we do not have a disease prevention system in our country. We have early detection. We have PSA, we have mammograms. We do not have a system of prevention in our country. Or, you can even expand that to the world. Because the model that we're dealing with does not allow it to happen. Because the model that we're using is not flawed, it's just incomplete. That's what it is. So, if my message here is first of all, understand that there is a player out there that is available, and that there is benefits to accessing that kind of system. Now, this is important to know, is that there's a lot of information on the street about energy work, what I would call energy work. And the issue is that energy work is, if it's not tied to a strong tradition, it's questionable. And I don't mean that in a derogatory way. I'm just saying that it has to be taken in context of a greater system, of the greater system. And that's a very important aspect, because what I'm talking about in terms of this model of healing, the energy science model of healing, is that it really is tenanted and based on a really well-developed, understood system of seeing the body as an energy field, energetically and anatomically and physiologically. Now, we're all, I think, interested in quality of life, not just quantity. So the energy science can really give you that aspect. It can give you quality of life. Who wants to spend their time in their, quote, golden years seeing doctors? And yet I saw that over and over again in my practice. And frankly, they weren't happy campers. They weren't people who really were interested in spending their time like this. And I heard any number of people say, you know, if this is the golden years, this is bullshit. And I think we all have seen our parents or other friends, relatives who have had that experience. And so the energy science can add to the quality of life. And therein lies this whole issue of what I said earlier about the idea of dealing with what many allopaths don't have many answers for. And that is the, quote, troublesome chronic problems that go on time after time. Because the molecular model deals with these issues that are big time hits. They're the big kahunas out there, the cancers, the issues around trauma. These issues are big time for us, and they raise big red fear flags for us. But the issue is that really the whole matter of chronic disease as we know it is really not handled very well. Oh, you're a little bit nervous, Mildred? Well, here's a tranquilizer. And oh, you're having trouble sleeping? Well, here's a pill. So everything comes down to taking a pill. And unfortunately, that's not where health is, really. So, you know, it helps with clarity of mind, it helps with increased energy, it helps with nervous conditions, it helps with sleep issues. So these are all these issues that are managed better with an energy science approach. And that's why I'm saying that actually it's not alternative medicine. What I would call it is holistic medicine, where there is a marriage between the matter and the energy science approach to healing. That's where we really, I think, are headed. And it's really becoming, I don't know about you, but it's kind of like inflation, you know, you kind of hear about it and then you put it aside. But, you know, there's this aspect that it's out there and you wonder about it, but you don't have any information enough to make any judgment about it. So it, in essence, kind of goes by the wayside. But what I'm saying is that there is really, in the back room, on the street, there is a paradigm shift that's occurring. And this paradigm shift is moving us into a different way of seeing the human body. as both an energy and a matter field, and that over the years to come, we will be seeing this holistic approach to healing, and you will be seeing it being employed in hospitals where side by side these energy sciences will be actively working. I mean, there are models already in the country at Columbia Press in New York, etc. All and many medical schools are involved in research around looking at these alternatives. So I think what we'll do is just open this up to questions right now.
Dr. Dean, I have a request from our cinematographer, manager. When you get a question, would you repeat it, please?
Oh, sure.
Thank you.
Yes, sir.
The book, I would assume, covers in much greater
Yes,
than our time.
it does. It essentially uses the nutritional model that is quite different than the molecular model of nutrition that's presently used in this country, and talks about it uses the nutritional platform as a way to compare and contrast the matter and the energy science
The name of the
of
book?
healing. Foods Heal? Yeah. I've written a second, actually, it's a second in a series on irritable bowel syndrome. This is a very common problem in the world, actually. I mean, and it's all revolves around the lack of adequate digestive strength or power. And, you know, in the West, the allopathic tradition, we don't have that kind of concept. There are many different things that are brought to the table with respect to the energy science that are not really even explored from the allopathic approach, and that's why the energy science approach can be so effective. But, oh,
How widespread is this approach? I mean, where is it being initiated here in the U.S. and around the world?
great. The question was how widely used and applied and accepted are these energy traditions? Well, I think all you have to do is look at acupuncture. I mean, acupuncture has exploded in this country. It's used a lot by many health consumers looking for a way to deal with their problems. But I think it's important to realize that acupuncture is actually a part of the traditional animal medicine discipline. And if you see any good acupuncturist, they will have you come back and talk about a herbal formula, etc. Ayurveda has its acupuncture, which is called acupressure, and some of you may have heard of the term marma therapy. And marma are just acupuncture sites, that's all. And applied pressure to these sites can invoke physiological change. How could that be? You know, you press on a point and it has something to do with having a headache clear from the body, or you press on another point and it has something to do with helping people with their hyperacidity syndrome. But I don't know if you've seen this or you've explored it yourself, but you know, if you have hyperacidity, some people have intuitively found that if they rub this point here, it in some way affects their acidic load. It's called Shankamarma, but the issue is that it has a direct effect on acid secretion in the gut. So the issue is that there are these various points, but the issue that I was trying to make during the talk is that these pieces that we explore have to be taken in terms of the totality of the system. And because one of the principles that's very important about energy science work is that it's not just one thing that I do. It's not just a couple of things that I do, but it's a complete panoply of things that I do in order to bring about healing in the physical body. So, you know, I might use marma therapy, or I might use herbal therapy along with it, or I could use lifestyle behaviors with it. And I might even employ some things that would be around helping improve digestion. So, in other words, it's a complete, what I would call a complete sandwich. You know, it's the idea of having a complete package to deal with disease. And that's why all of these things interplay with one another. So just going to somebody to just get acupuncture is not really enough. It's a window, but it should be employed with other things as well.
Well, what kind of success has this had with the traditional medical community in trying to work together and make all this happen?
Yeah, you know, it depends on the medical community. And I think we all know that some medical communities may be more advanced in their thinking than others. And some may be more stoic or staid in their approaches to disease. And more maybe what I would call maybe more conservative. And again, it's not being derogatory or making a judgment. It's just the fact that there are what I would call little enclaves, if you will, in the American community as well as in the European communities, looking at ways or alternative ways of therapy. In trying to give you numbers, it's really difficult. I can say that, you know, I pointed out New York Press, and there are, I know Duke has an active program, USC, UCLA have programs that are exploring these kinds of things. One of the things you have to realize about the communities at large is we want to see numbers. And so people want to see, well, if you're going to deal with IBS, irritable bowel syndrome, then show me the numbers, show me how successful you are. And right now, it's really just too early to say. But I can tell you this, that the foundational principles from which this works speak for themselves in terms of how it deals with disease. I'll give you an example. There's this lady who I've been working with online. She's been to 3 medical centers in a major metropolitan area, and the people have told her, in essence, we don't have anything to offer you. It's just, you just have a problem that we don't understand. So this lady and I have been working for about now 12 months. Before she started doing this work, she was actually debilitated in her home. She wasn't able to get out of the house anymore. She used to go work out every day at the sports center, but that fell by the wayside because of her symptoms, primarily around her bowel. But over the time that we've been working and doing things in many different ways, she's now able to be out of the house, she's able to meet with her Bible study group, she's now able to ride her bike, she's able to eat foods that she wasn't able to do before, and the incredible pelvic pain that she had is now gone. So there is no quick fix with this stuff. It's just a matter of exploring the problems and trying to find solutions for them.
You mentioned the 4 stages that the energy model purports that precedes overt manifestation of symptom.
That's a beautiful question. So Ayurveda says that all disease except trauma, begins in the GI tract. That means that your prostate cancer began in the GI tract because of an imbalance, qualitative imbalance. And this accumulation of these qualities, these vibrational frequencies actually, these vibrational frequencies become accumulated, aggravating, and then spread. This is not a process that occurs over a couple of weeks. It occurs over decades. And I think that you're all aware of the fact that actually your prostate cancer started in your 30s or early 40s. Maybe you're diagnosed in the 50s, but your disease actually started in your 30s and 40s. And that's been shown by a Detroit autopsy series that was done about 10 years ago. But I think it has salient relevance for us with respect to this whole aspect of prevention, what we're talking about. So these qualities then disperse and they go out of the GI tract, and then they start causing mischief. And in this situation I was talking about with this lady, she actually, her pain in the genital tract, in her vulvar area, in the perineal area, and in her bladder, they were all related to these qualities being deposited into her pelvic nerve plexus. And through this 12 months, what we've been doing is therapies in order to bring these qualities back into the GI tract and allow them to be eliminated. So that's the fourth step, is localization. These qualities get localized. And then after that, they start causing symptoms. But here you have it. This origin of disease started way back when she was in her 30s, 1970s, and they evolved into 2011 being to the point where she was totally incapacitated. So you see the issue here in terms of understanding the origin and the progression of disease. A very important concept. Thanks very much for the question. Yeah?
You say all diseases originate in the tract. What about diseases like ALS and
GI tract. GI tract. The question was, you say all diseases begin in the GI tract. Well, what about ALS and autoimmune diseases and those kinds of diseases? Same deal. Same deal. It's just that the molecular expression of these diseases occurs at a cellular level. But the point here is that, I'll give you another principle here, that disease in the GI tract occurs because of the production of toxic load, for want of a better word. And this toxic load gets carried by these vibrational frequencies to the distal tissues, and these tissues then take up this toxic load, and the cells become covered or in some way altered in terms of their surface. And one of the things we know from the matter science work is that these cellular surfaces, when they are not recognized as self, become the seat of autoimmune disease. So cells are altered peripherally, and when they get altered peripherally, it's the foundation of autoimmune disease. So it still is relevant to what we were saying earlier, that toxic load, GI tract disease is the seat or the cause of all diseases in the body, except for trauma, of course. I mean, GI tract wouldn't have any response to that.
that reason leads me someplace I don't understand.
Yeah.
The reason I ask that is 5 direct members of my family have ALS. I had ALS and died of it. Mother, 2 brothers, first cousin and nephew.
You know, sir, the issue about autoimmune disease in general is that it actually is, it's a genetically driven disease, and I believe that almost all diseases that we see in the body are actually a result of changes in the genetic structure. So, but it gets us back to prevention. If you know that you have a strong history of ALS, then one would be wanting to do things to change the molecular expression of your DNA.
How does
And
that happen?
through energy science work, through prevention. See, the issue is this, is that it's now known. This is not something that is not talked about. It's known that if you do make lifestyle choices and change those lifestyle choices, if you do that, you change genetic expression. End of story. End of story. If you do lifestyle choices, you do nutritional changes, you make up your mind to do something different, you change your molecular expression. There's a guy by the name of Ornish. Some of you may have heard of Dean. Dean Ornish is an internist who's at UC San Francisco. And what he showed, this is profound science, what he showed was, this was in conjunction with the urology department at UC San Francisco, he showed that if you changed diet, lifestyle choices, made specific things change in your life, that you changed and altered the genetic expression of prostate cancer genes in the body. This is done in a controlled study with a group of men who had prostate cancer, documented by prostate cancer or prostate biopsy, but they were placed, because of their indices of the disease, they were placed into a watchful waiting protocol. And these men were then sectored out into a control group and a treatment group. And they showed that 60% of their genetic expression with respect to prostate cancer changed during a 3-month period just by doing lifestyle stuff.
3 months? Wow.
It was profound. I mean, you cannot ignore this stuff.
What, okay, is exercise part of that?
Sure.
Okay. Is becoming a vegetarian part of that?
No.
Huh?
No.
Okay, why not?
Well, it's because Ayurveda would say that, whether you're a meat eater or not does not determine health. Now, we have to define that, because how much meat are we talking about? I mean, if we're talking about the American size of meat portions, no, it's probably better to go the other route. But if we're talking about a semblance of moderation, yeah. And what type of meat? Is it pork and lamb and duck? Or is it bison or buffalo? Or is it freshwater fish? All of these impact and have a significant difference on how meat affects you. Yes, sir.
Does that genetic expression change permanently, or do you have to keep it up?
Yeah, that's a great question. Actually, I think you have to keep it up. See, the thing about it is that one of the things you have to realize about the DNA, which is really, by the way, an expression of the mind. It is the bridge between mind and physical body. But if you change the molecular expression of your DNA and the genetic expression, then what happens is that if you go back to your old habits, the reverse will happen, because DNA is the most malleable molecule in the body. End of story. It is the most malleable. It is the most changeable of all the molecules in the body. And so when we talk about the expression of mind is very malleable, right? Have one thought, goes, catch another one, catch another one. They're like clouds. They're drifting through our awareness. And so is it like DNA. DNA is just a cloud of energy, and it changes according to our, what I would call, whims. What Ayurveda says, what the energy science says is, hey, look it, here are some guidelines by which you should live. Here are some guidelines. And, you know, where do you find that? I mean, if you're lucky and you grow up in a family that showed you what were good bedtimes, what was good to eat, and what was bad to do as a health, health kinds of habits, I guess you could call them health habits. If you were lucky enough to grow up in a family like that, then more than likely you'd have an easier way of it. But unfortunately for us, you know, many of us don't have that. We don't come from enlightened.
Well, what you're saying, that would be related also to evolutionary general adaptation?
Totally,
Yeah.
absolutely. It's just an extension of the issue of why do we have so much obesity in our country right now? Well, excuse me, I mean, we've got a society that's penetrated with abundance. We don't know how to deal with our abundance. So what do? We just become obese because abundant societies become obese. I mean, that energy of abundance just totally reflects right through your physiology.
So Dr. Dean, are you practicing this with people for preventative reasons, which is
Well,
related to
actually,
curative disease reasons like this woman you're talking about?
yeah, I'm actually using it in both ways. I'm working with a naturopath here in the community, and I'm doing online consulting work. My mission is to use this in the worst of cases, because that's where I want to see it shine, you see. I mean, I don't want to do a lot, you know, health counseling is good. I mean, it's good. But as I said, you know, are we really willing to do things if there is no PAIN? No. I can guarantee you. I mean, it's just not going to happen. I've seen it too often in my practice. The people who came in with interstitial cystitis and they had this problem going on and they were miserable, and then they changed their nutritional format. One young gal said, "I can't believe foods did this to me. You know, I can't believe it." You know, so it's just an understanding and appreciation that simple things can bring about great health. But the issue is there enough pain? And in answer to your question, most of the time people will not undergo these kinds of treatments and therapies unless there is significant debility for them. That's why I'm looking for it. I have a lady in Switzerland right now. She wants to start a family. She's a young lady, and she has vulvodynia, that is pain with intercourse. She just got married, and she can't function. It's the pits. She's desperate. Talk about pain. I mean, not only does she have pain sitting, but she has pain emotionally. I mean, she is just, she'll do it. She'll do the work. And so that's really what I'm looking for.
Dr. Dave, is the school up in Seattle committed to this?
No. They're totally, I mean, I can't,
I don't mean
You-
University of Washington, I'm talking the other one.
oh, Bastyr?
Yeah.
Oh, yeah. I'm on their faculty right now.
Okay, that's fine.
Yeah, we just finished our first year of Ayurvedic sciences there.
Okay.
And we're starting on the second. We're
So
gonna
a lot
start-
of information-
Starting in the clinic.
So we can get some of this off the internet about it.
Yeah, it's available.
Is integrative medicine interested?
That's a great question, Jerry, because actually, you see, I kind of think, I use the term holistic medicine, but it's actually, I would call it an integrative approach as well, in that you're integrating the energy model and the molecular model together. So another good term would be an integrative approach. If you're using it in that term, it's such a hodgepodge of terms out there, it's just, it becomes very confusing, and that's why it was a unique opportunity tonight to just talk with you guys about putting things in perspective, because the issue is that there's so much, what I would say, garbage out there, you just really have to have a different perspective.
But isn't integrative medicine one of the paths that's being used in allopathic medicine now? Isn't that a term that's common?
Well,
And does it include Ayurvedics is my next question.
Yeah, right. The issue is that what I've been talking to you about tonight, these two different models, a way of getting, is really not mainstream by any sense. And it's really my own thinking through this process and trying to understand the problems. And I sit in a very unique position because I'm both an allopath who's experienced the matter science approach, but I'm also trained now